2021 Wellness Retreat is an opportunity for clinicians and non-clinicians to enjoy fall in Tennessee and maybe even a leaf change while you take a deep dive into learning about the mind-body connection and strategies for improving your overall well-being. Up to 21 CEUs will be available for clinicians, but again, you don't need to be a clinician to attend. The retreat is being held October 20th through 23rd at Cumberland Mountain State Park and is limited to 60 people to allow me to have plenty of time to interact with everyone. Go to allceus.com/wellness to see the detailed schedule and download the registration form. I look forward to seeing you there. I'd like to welcome everybody to today's presentation on child and elder abuse prevention. This is the second half of a class we started a week or so ago on child and elder abuse prevention. This is, Child Abuse Prevention Month. I'm your host, Dr. Dawn-Elise Snipes. In this presentation, we're going to define 3 types of prevention, review risk factors for abuse, just for anybody who hadn't seen the first part, identify strategies for preventing abuse and neglect, and discuss reasons prevention programs fail. And I am going to be asking a fair number of questions of you, and they're not rhetorical because, unfortunately, as I alluded to before class started, there is a relative lack of research out there of or knowledge, if you will, of programs that actually work. I mean, there's a lot of theory out there, and we know that, for example, if you increase economic opportunities and increase the living wage of people, you reduce the risk of abuse and neglect. So there's a lot of stuff that we kind of know, so to speak, but as far as a framework that has been consistently implemented, that has been effective at achieving those goals, we fall a little bit short. So we'll talk about some of that. 3 types of prevention: primary, secondary, and tertiary. Primary prevention is typically what we think about with prevention. You want to keep it from happening. You want to prevent yourself from getting sick. You want to prevent yourself from, developing diabetes. You want to prevent children or elders from being abused. Ever. Just keep it from happening. Secondary is preventing worsening. And in the case of child or elder abuse, what we're really talking about is maybe the caregiver. You've noticed that the caregiver is a little bit agitated, seems to be more cranky, borderline verbally abusive, having difficulty really connecting with the patient. That is a place for secondary prevention. It hasn't escalated to the point of physical abuse or severe neglect. We want to get in there and stop the progression and hopefully reverse it. But we're still talking about that target issue, and in this case, abuse or neglect. Tertiary prevention is preventing additional issues. So when we're talking about child abuse and neglect, if you have a child or elder that's exposed to abuse or neglect, obviously there are going to be certain, ramifications of that, whether it's malnutrition or injuries or what have you. Okay, we want to prevent that from happening. We want to stop that from happening, but we also want them to prevent them from developing additional issues like substance abuse, clinical depression, homelessness, other problems that are caused by or as a result of being abused or neglected. Real quick review of risk factors. High levels of stress and low or ineffective coping resources. And this is true whether we're talking about child abuse or elder abuse. If the caregivers have high levels of stress, they are, I've used the analogy of a pressure cooker before, and they're at their max pressure, and it doesn't take much to blow the top off. Or as the old saying goes, the straw that broke the camel's back. If that camel is already carrying as much of a load as it can, it doesn't take much in order to break the poor camel's back. That's a horrible, horrible analogy, but it's one we use. Anyway, so if a caregiver is under high levels of stress for any biopsychosocial reason, it is potentially a risk factor for having difficulty connecting with the individual that can lead to neglect, having difficulty paying attention to the individual that can lead to neglect, or abuse, which is, verbal or physical abuse, financial abuse. If the person's having financial difficulties and has a lot of financial stress in their life, then they may be more vulnerable to perpetrating financial abuse if they see that a vulnerable loved one may have financial resources. Sexual abuse is another that, we definitely want to keep in mind when we're looking at different types of abuse. But so high levels of stress and low or ineffective coping resources are really important. And when I say biopsychosocial, we're really talking about housing, finances, employment, medical issues, mental health issues, communication issues, parenting issues, anything that might be stressing that caregiver out. If the caregiver or the child or elder has a history of abuse or neglect, it increases the risk of future abuse or neglect. We want to break that cycle. If a child grew up in an environment that was neglectful and that's all they ever knew, they were never exposed to positive, attentive parenting, well, we can't expect them to have a baby and magically become a positive, attentive parent necessarily. It can happen. I've seen it happen. But more often than not, people do what they have grown up with. People live what they learn, so to speak. So it's important to recognize that if somebody has been a victim or a perpetrator, that we may need to intervene to help break that cycle. If there's a lack of social support, that's also another risk factor for abuse or neglect. If somebody is just overwhelmed with their own stuff, then they may have difficulty attending to that elder, the needs of that elder or that child. And it's often, in the cases of neglect, a lot of times it is not intentional. The person is just, their mind is focused somewhere else because that's where a greater threat is to them at that point in time. I had a employee once who was very overwhelmed with a lot of stuff that she had going on in her personal life. And she was unable to focus when she was at work. She spent a significant amount of time at work doing her own case management and engaging in resolution of some of her own issues instead of doing work. She wasn't intentionally neglecting her work duties, but it was a side effect of the fact that she just couldn't clear her head and focus on what needed to be done. Financial instability or poverty, obviously those are stressors. High emotional reliance on the elder or being seen as a good parent. If somebody's parent or grandparent becomes ill and this person relies on them for emotional support, relies on them for financial support. Well, when that elder gets sick or incapacitated, then they are not able to meet that adult's needs, and that can create stress on the adult, which may lead to irritability, neglect, or even abuse. In terms of children, if the caregiver has a strong need to be seen as the perfect parent, then there may be a lot of enmeshment, there may be a lot of scolding, there may be a lot of harsh discipline in order to make sure that the child falls in line so that they can present that perfect facade to the external world. Lack of skills in parenting or taking care of the older adult can also lead to neglect and abuse. In terms of neglect, if you don't know what the child or elder needs, you may not be meeting those needs. You can't do something that you don't know it exists. So it's important that we make sure that caregivers feel like they have the skills and tools they need to meet the needs of whoever they're taking care of. Now, it can morph to abuse, for example, in the case of somebody with dementia. If the person who is caregiving doesn't understand how to communicate with a person who's cognitively impaired, then that can create frustration in the person with dementia. The person with dementia may start to act out or become aggressive or agitated, which can lead the caregiver to respond in kind with agitation or aggression and potentially, again, be verbally or physically abusive. So we do want to recognize that a lack of skills is a huge risk factor, and we want to assess caregivers. And that includes other professional caregivers like CNAs and case managers and anybody who's interacting with the person that has needs, to make sure that they have the skills and tools they need to understand how to deal with the specific issues that that person may be presenting with, such as a person with autism spectrum disorder or dementia, or even a person with clinical depression or schizophrenia. We need to make sure that the caregivers feel competent. If the caregiver has mental health or addiction issues, or if the child or elder has mental health or addiction issues, it can put the child or elder at risk for abuse. So we want to make sure those referral resources are there. Physical health issues can confound the problem. If you're not feeling well, it's hard to connect. If you are, in a lot of pain, or if you've got a fever and you're all stuffed up and snotty and bleh, it's really hard to engage. If this is an ongoing, every once in a while we have 24 hours, 48 hours where we're sick as a dog. But if this is an ongoing physical health issue, it may impair the caregiver's ability to effectively care for the individual, whether it be a child or adult. And it also may make them more prone to irritability and outbursts, simply because they're sick or they're in pain, but also depending on the medication they're on, decongestants, for example, can increase agitation. And if the child or elder has a disability that requires a lot of care, it can be exhausting to caregivers, especially if it's a caregiver who doesn't feel competent at changing an ostomy bag or whatever needs to be done. So the combination of a sense of incompetence combined with the high level of energy required to care for that individual can lead to abuse or neglect. Likewise, unfortunately, if children are born or develop disabilities, sometimes parents may reject them. And that's a whole other issue. But if parents don't feel like they can connect with their children, or if they resent the child for how much time it takes, or they're angry at themselves because they feel they caused it, there's a lot of reasons why the parent may reject, or the caregiver may reject the child. But we do need to recognize that if that attachment is broken, if there's rejection there, then the child is at greater risk for abuse. This is another issue, and that a lot of people with children with autism spectrum disorder struggle with, because a lot of parents with children with autism spectrum disorders report that they have difficulty connecting with their child, and they don't feel like they're connected with their child, which makes it harder to empathize, makes it harder to understand. So those are all target issues from a counseling social work perspective that we can take a look at in order to reduce risk factors. So some strategies for prevention. And as I said earlier, a lot of these are pie in the sky. They sound great, but how do you actually operationalize them? And there was very little research, very little guidance or white papers or anything on examples of operationalization. However, strengthening economic support, some of the ideas that I came up with, remote work opportunities. Not everybody can go into work. In places like rural Tennessee or rural Florida, yes, there is such a thing, there may not be a lot of work opportunities in that town in which the person lives. But in a lot of rural places, there's really good stinking internet. So people who have skills that can be implemented remotely may be able to work remotely. And we want to encourage people to explore these ideas. Now, working from home, remote work, whatever you want to call it, it is not the panacea that you think it might be. It requires a lot of discipline, a lot of structure. So somebody who's working remotely, who's never done it before, may need some assistance figuring out how to structure their day and get things done. But it is an option out there. There are a lot of things. I mean, obviously, counseling. MD Live does medical appointments online. Lawyers do virtual counseling now. There's a therapist in town who even does remote hypnotherapy. So there are a lot of things, customer service, there are a lot of things that can be done remotely. Affordable childcare or adult daycare. Now, childcare, we know what that is. And childcare is expensive, but it's a necessary expense. Childcare providers often aren't charging an arm and a leg just because they can. It requires a lot of overhead, especially for infants, because the infant to caregiver ratio is so low. So figuring out ways to provide affordable childcare, providing childcare at larger businesses can be a great way to strengthen the economic situation. And it doesn't have to be free childcare at the organization, but affordable childcare. And adult daycare is not a senior center. Adult daycare, clubhouse activities, they go by a variety of different names, but these are day treatment programs. I'll use that word. I like that better than daycare, but day treatment programs where adults with cognitive, emotional, or physical health issues may go in order to allow their caregivers respite or an opportunity to work, or just because they need to go there to get their therapy or their interventions each day. One recommendation from a HIV white paper was multi-sectorial pro-business communities to increase all job opportunities for youth and adults, creating economic development zones. And those are specially federally funded, grant-funded zones that can encourage specific types of development like technology in a particular area, bringing good internet to those cities and towns to make sure that people have connectivity. So if they want to work remotely, they can. But also focusing on making sure that there are opportunities not only for adults, but also for youth. That can go a long way to giving youth things to do, which can reduce, if they're engaged in pro-social activities, it's going to reduce some of the problems that we see, such as substance misuse, teenage pregnancies, and those sorts of things. And transportation. Now, it's a little bit easier now that Uber exists. Used to be when I lived in Alachua, Florida, which is like 15 miles north of Gainesville, but it could have been 150 miles for that matter for people who didn't have a car, because there was no taxi service that was, easily accessible. There was no bus line. There was no anything to get people to Gainesville. So figuring out ways to increase transportation, increase access in the community is really important to strengthening economic supports. One of the best ways in each community to strengthen economic supports is, drum roll please, a focus group. What my town in Lebanon, Tennessee needs is going to be different than what Nashville needs. It's going to be different than what Murfreesboro needs. So getting people together in your community who have these needs, not people who think they know what people need, but people in the community who actually, need access to transportation. They need work opportunities. Engaging them and asking them, what is it that prevents you from acquiring and maintaining what they call a high wage, high demand job? And high wage is kind of deceptive, but and that's one of the things that workforce development usually works towards, is helping people get those jobs and keep those jobs. But until you know what the barriers are, you can't remove them. So engaging a focus group can be a great way to start, and then prioritizing the needs that are identified and bringing them up to city councils, town councils, and even community organizations, interfaith service groups that may be able to help bridge the gaps in order to make these services available. It takes getting creative. It takes somebody or some buddies who are willing to get outside of the box and say, okay, well, we can handle this task right here. We can handle, maybe the Rotary Club decides to start recruiting businesses to come to that community that would bring high wage, high demand jobs. It doesn't have to be just we're going to sit here and wait and see if somebody shows up. We want to be proactive, not reactive. And there are people in the community that probably have skills to do each one of these things, like reaching out and soliciting businesses to come to town. People who are able to provide child care, organizations that can provide adult daycare. So figuring out what those needs are is what I'm saying. And again, start with a focus group of the people who need the services, and ask them, what is it that you need? The second strategy identified is social norms supporting culturally responsive, positive caregiving. And these strategies come out of the CDC white paper that are in your class. But again, they're really pretty vague in there. They give some ideas of different things to do. So it's worth perusing that white paper. But there are a lot of things that I think are going to be unique to each community. So motivational enhancement is the first thing that I have on this slide, because for people to engage in positive caregiving, for people to change their habits, for people to think, oh, well, maybe I need to learn some parenting skills, it needs to be presented in the right way. And there is a publication, again, in your class on framing that talks about different ways to frame activities so they don't feel condescending. A lot of people get very offended, and I can see why, if you say, hey, Jim Bob, you need to go take this parenting class. And Jim Bob may feel very offended that you're being critical of his parenting. So it's important to present it, to frame it in the right way, to present it in a way that is accessible and meaningful to each individual based on their individual needs and their culture. Not every culture parents the same way, but there are some issues like child development that are pretty standard across cultures. One of the unfortunate statistics that I found, or statements that I found, was that although a broad range of programs have been developed and implemented by agencies at many levels, little evidence supports the effectiveness of these programs. And that's what I was saying earlier. I did a training in Chicago last year. Everything's just gone by. Yeah, it was in 2020. And one of the things we talked about repeatedly was the fact that a lot of times well-meaning agencies think they know what people need and want and provide those services, instead of asking people, What is it that you actually need and want? And what are you motivated to access? I mean, you can provide yoga and Zumba classes until the cows come home. But if people are worried about how they're going to put food on the table, they're not going to be bothered with coming to those classes. When I worked in Gainesville, we had several prevention programs that we did that were grant funded, SAMHSA things, and maintaining engagement was always very difficult. Not because the parents didn't care, but because the parents were too overwhelmed with the rest of life. They had to work. They had other kids. They couldn't afford childcare for their other 3 children to be at this prevention program with their middle school child. There were a lot of obstacles that we hadn't considered when we implemented the program, which again is why it's so important to look at the program that you're wanting to implement. And there are a lot of evidence-based programs out there, and then present it to the people in the target population and say, what do you think? Is this something you need? Number one. And if not, well, then we're done. If it is, how can we make this accessible and meaningful to you? Public service announcements can be very helpful. It's sort of like the Instagram for television and radio, providing little tips and tools that caregivers can use, adult or child caregivers can use, in order to reduce their stress, improve their health and wellness, improve their sleep, so they can cope better with life on life's terms. Library programs. These are free programs that can be made available, and they can be, 30 minutes every week or one Saturday a month, or however the person hosting the program wants to do it, but providing information on a particular topic, like parenting the preemie, or parenting a child with ADHD, living with adult ADHD, caregiving for someone with dementia. There are a lot of programs, and as counselors, social workers, marriage and family therapists, even pastors, I'm not sure who all's in this group, not only is it a great opportunity to give back to the community, which is one of those ethical things, the beneficence, but it's also a great time to connect with the community. And, you don't have to advertise, you don't have to push it on them, but once they connect with you, once they have talked with you, interacted with you, they've developed some level of comfort with you, and they're more likely to call on you should they ever need your services. So it's kind of a win-win for the person doing the presentation. Faith-based programs, and what I mean by this are programs that are put on through faith-based organizations. And it's not necessarily just churches, but maybe interfaith programs that are facilitated. We used to have a faith-based program, faith-based service in Gainesville that provided free and low-cost healthcare, dental care, and mental health care. I believe it was twice a month, one day, each of those times, twice a month. And people were able to access some of the services that they needed. And it was supported, it was organized by the different churches in the area who would find parishioners who had those particular skills who were willing to volunteer. What else could you do? And I'm asking this for a response. What else could you do in order to create social norms that supported culturally responsive, positive caregiving? Attitudes about parenting practices differ, between cultures, even between, and it kind of is a culture between urban and rural areas sometimes. And it's important to be respectful of people's belief systems. But positive caregiving can also be accomplished in some ways by just providing education. A lot of times, and the CDC actually has a couple handouts on this, a lot of times if caregivers understand, for example, with children, the developmental stage that they're in and what they can do to enhance that child's communication skills, self-esteem, sense of personal efficacy, parents will do that. But we need to provide it in bite-sized amounts in non-threatening situations. A lot of people are not going to take 4 hours out to go to a presentation, even though, I think library programs are awesome. Attendance at those is usually, even in larger towns like Manassas, 20, 25 at best. So it is important to make sure to figure out creative ways to get that information in the hands of parents or caregivers. For adults, people caring for older adults, it's important to, again, provide them with the tools and the information they need, in the case of dementia, for example, to understand what's going on with that person, the most effective ways to communicate with them. Because when it's a positive communication and when it's not a power struggle, when it's not a fight, when it doesn't feel like it's an oppositional situation, then it greatly reduces the tension and the distress, which goes back to ensuring that caregivers have adequate education about the needs of the identified patient. Same thing if the person has schizophrenia, for example. If they are in an active psychotic state, understanding that and understanding how to communicate with that person in order to keep them safe and also be positive as much as possible, not derogatory or critical, even if the person, as I said, is in an active psychotic episode. Quality, accessible care, and we've touched on this a little bit, but it is important for caregivers in general, whether it's children or elders or adults, having some sort of day services that the identified patient can go to can be a huge help, because if the caregiver has to work, even if they're working from home, they may need 8 hours of uninterrupted time where they can do their job. So providing resources that enable them to not only get respite when they need it, but also to be able to work so they can remain financially stable. And they can interact in a different situation. They can take a break from that role right there. It can be extremely helpful. Schools, well, obviously this applies to children, not adults, but making sure that there are opportunities for children to interact with other people. Public or private schools, if you want them to go to a brick and mortar school, or if the parents are engaging in homeschooling, that's fine. Homeschool co-ops are wonderful. Our homeschool co-op, there was the option to enroll in the co-op opportunity. Each parent in the co-op took a turn 1 day a month and taught a particular subject. So parents weren't having to teach everything every day. Some parents loved that, some parents didn't. The homeschool co-ops also had activities. There were interfaith athletic leagues, like interfaith football, soccer, tennis, cheerleading. So the youth were able to engage with other homeschool youth. This also is beneficial because it means other people are getting eyes on children. It's not as easy with the older adult unless the older adult is going to some sort of day treatment. Another word about homeschool, even if they're not in a co-op, in many locales, homeschoolers are allowed to partake in extracurricular activities in the public school system. So they can be homeschooled, but play on the local school's football team or tennis team or whatever it is. So that's something else to look into if the child is seeking interaction with other children. In-home care is also super helpful. Not everybody can afford it. It is expensive. It can be paid for some people if they have long-term care insurance. Sometimes the long-term care insurance can be used to pay for in-home care. If it is short-term in-home care because, grandma had her hip replaced or, you had your knee replaced and you aren't mobile for a short period of time, insurance, private insurance, Medicaid, Medicare may cover short-term in-home care. So it's important to know the parameters of the different insurance policies for people. If you are a provider, to make sure that they're getting their needs met. Recovery is going to be a lot swifter if they have a lower stress level, and also if they're able to be compliant with their recovery guidelines. If they had their knee replaced, but they're still trying to get up and hop around to let the dog out, they're probably not going to recover as quickly as somebody who was able to actually stay off of it. Case management, to meet biopsychosocial needs and to navigate the medical insurance system in the case of elders or a child with a disability. It can get overwhelming to caregivers to try to navigate the medical system. It's overwhelming to me. And my daughter has a couple things going on right now and trying to get a primary care appointment and the MRIs scheduled and this and that and the orthopedic. It's overwhelming trying to juggle all this, and the left hand won't talk to the right hand until there's orders written from somewhere else. So it can get exasperating for caregivers sometimes, and that adds to their stress. Increases in stress, increases in vulnerability to abuse, which is why we're talking about these things. In order to prevent abuse, we want to prevent stress in the caregiver and make sure the caregiver feels competent and empowered. Likewise, if the caregiver has pre-existing issues, we want to make sure that they are able to access services necessary in order to prevent those issues from getting worse. We don't want them to, if they're in recovery from addiction, we don't want them to relapse, for example. Over 10,000 people come to BetterHelp every day looking for a counselor. BetterHelp makes it easy for you to move your practice online and focus on what you love most, helping others. BetterHelp's easy-to-use platform takes care of referrals and billing and provides a secured platform to communicate with your clients. Join more than 18,000 therapists at BetterHelp, helping to improve people's mental health and lives. In terms of parenting skill enhancement, providing information about attachment-based parenting and what that can be very simply boiled down to. It can get very detailed and in-depth and all that kind of stuff. But on the very highest level, we want to help parents, caregivers understand, and this is true for children and adults and and elders. Securely attached relationships have certain characteristics. They're consistent. The person, what to expect from Sally Sue pretty much all the time. She's consistent in the way she responds. She's consistent in what she does. You know what to expect. My stepfather, he was a man of routine, and he ate the same thing for breakfast, I think, for the last 30 years. So whenever he would come visit, or I would go visit them and I'd be up first, I would know what to make him for breakfast. It was consistent. So it was predictable, and predictability tends to reduce stress. But that caregiver being consistent means the identified patient feels more secure because they know they can expect that caregiver to consistently and appropriately respond. And responsiveness is the second aspect. When that caregiver is responsive to the child who is afraid, or the child who's in pain, or the child who is, fill in the blank, helping the child learn the skills needed to emotionally regulate can be super important because they're not born with that. So a responsive caregiver helps the child feel safe and helps them learn the skills and tools to deal with life. In the case of an elder who has dementia, for example, being responsive to that person, and instead of getting angry because they have taken off all their clothes and they're running around the house butt naked and have cleared everything out of their closet and put it on their bed, exploring that, being responsive to that in a positive way that says, okay, what does this behavior mean? Because it means something. The person with dementia is trying to communicate something that they're not able to articulate in words. So being consistent and responsive, validating the person's situation is important. We all want to feel validated. We want to have our perceptions and our feelings validated as real to us. They may not be real to the other person, but they are real to us. If Johnny's afraid of the monster in the closet, we can validate that he has that fear and then help him explore, alternate realities, for example. But validation is important. Instead of telling somebody, no, you're wrong. Encouragement and support are also important. And yes, I skipped over attention because when you're dealing with distress, we want somebody who's consistent, responsive, validating, encouraging, and supportive. We want somebody that's going to help that person feel safe in that environment and in that relationship. Attention is just stuck in the middle because that's where it worked in the mnemonic device. But attention is, kind of its own little thing in attachment-based approaches, not necessarily just parenting, attachment-based caregiving, that's proactively giving attention to the identified patient. Proactively sitting down with the child and say, let's build Legos or whatever it is the kid likes to do. Or sitting down with the elder and turning on their favorite music and listening to it. I remember when I was little, my grandma used to keep me every Saturday, and we would play checkers and gin rummy after dinner, and then we would watch The Love Boat, and then Fantasy Island came on after that. That's how old I am. And then I would go to bed. But to this day, 40 years later, I still remember that vividly. It was so meaningful. And I knew that interaction, it wasn't forced. She was wanting to spend time with me. And that meant a lot to my self-esteem. The same thing is true with adults. We don't outgrow this need for secure attachment. We just stop relying on one person for everything a lot of the time. So you may have multiple securely attached relationships. And providing developmentally appropriate caregiving strategies is really important. And with children, obviously, that's appropriate to their psychosocial development, biopsychosocial development, based on, including any issues that are associated with a disability. And for adults and elders, providing appropriate caregiving strategies that are based on the stage of their illness. What they need. A person who has stage 1 dementia is very different than what a person who has stage 4 dementia needs. What a person who is stable on their antipsychotics, who is schizophrenic, needs is going to be different than what they need when they are in an active psychotic episode. So making sure that people have those skills is important. Early intervention is one of those other ones that, you'll love to have out there. Encouraging people to get involved. If you see something, say something. If you think that there might be abuse or neglect going on, it's worth taking seriously. And in Florida, it was always great to work with when we had to. I hated working with them because I didn't like the fact that abuse or neglect might be going on. But working with the abuse hotline in Florida was always a positive experience because I could call them and sometimes I would call and say, I don't know if this needs to be reported. Does it meet the threshold? And I would give them an overview of what was going on. And they'd either say, no, don't worry about that. And I would get their ID number and everything to note in the progress notes. But if it was something that needed to be handled, then obviously they would take the report. So it's always better. I was always taught that it's always better to err on the side of caution. With early intervention, and there's a whole other class, there are multiple other classes on abuse reporting. But if it is safe, it's usually better to have the caregiver or a caregiver make the report themselves. And sometimes that's not safe and you're not going to do it. You're going to just wait till they leave and you're going to call and go, oh, there's bad stuff going on. But other times it can be empowering. For example, if you're working with a mother who believes that the male in the household is being abusive, empowering her to make the call in your presence, so it gets done, can be much more helpful sometimes if she's willing to do it than doing it for her after she's left. That way everything is kind of out in the open. But anyway, see something, say something, educating preschool teachers and caregivers and pastors about what abuse might look like so they are in a better place to make the report. Early steps. If a child has birth to 3 is starting to show signs of a developmental disability, this does not always get picked up by the pediatrician because children don't always go to all their pediatric visits. But if it's noticed by the caregiver at church or by the daycare provider or someone, anybody in most states, anybody can make a referral to Early Steps, and they provide early intervention for children who have or are at risk of having developmental disabilities. So that can prevent the disability from emerging, or at least provide the family tools to deal with it a lot more effectively. Making a pediatrician referral is also important to be able to do for early intervention if a child seems like they need to be assessed. And school counseling services. Sometimes parents can't get away to get their kids to counseling or what have you. And it's important that children can be able to access those services. So parent approved isn't the word I'm looking for, but providing counseling services at the schools can be extraordinarily helpful for parents so they don't have to worry about leaving work and toting Junior across town. Community connection is also essential. We want to reduce isolation of caregivers as well as reduce the isolation of clients. Clients who are isolated often become depressed or agitated. Caregivers who are isolated often become depressed, overwhelmed, or agitated. So respite services, sometimes it can be as simple as having an area in the community center or the library where people can come and they don't necessarily have to be quite as quiet. I've shared that with you before. In Alachua County, we used to have a kids area in every library in the county. And there were beanbag chairs, there were obviously kid-appropriate books, and there are generally 8 to 15 computers with kid-appropriate games that the children could come in and play, and the caregivers could just sit and kind of breathe for half a second. Respite services provided, sometimes churches will provide those where they have a 2 or 3 times a week where people can come and bring their children, and they've got volunteers that will do activities with the children so the parents can drink coffee and talk with grown-ups that speak in full sentences. That can be a nice relief. Support services can be helpful if you can figure out a way to pay for them, in which people actually go into the home and provide support to the caregivers, whether it's elder or a child. Accessible, age-appropriate, pro-social activities. If you've ever been locked down with your kids, and I think most people have now, especially for an extended period of time, they start getting antsy. And that's just part of being a kid. So having accessible, age-appropriate, pro-social activities can be huge. You can do this in clubhouses, at apartment complexes. You can do this at community centers. You can do this. There are a lot of different places, parks, community parks where kids can go. But it's also important to remember that kids are more than elementary school and younger. The teens and tweens need activities, need pro-social activities to engage in as well. And teens and tweens who don't have something to do, who get bored, who get agitated, who get irritable, can be more challenging or oppositional to their caregivers, which increases stress and can promote a higher risk for abuse or neglect. In the community, reduce violence. If people feel safe in their community, if there are economic opportunities in their community, they're likely going to stay in the community. They're likely going to develop more diverse supports and connections in the community and feel a part of it. When there is violence, people don't feel safe. When they don't feel safe, their threat response system is always activated, which primes them for emotional dysregulation. Enhance mental health by making sure that people have access to adequate, healthy nutrition, food pantries, community gardens, as well as health education. Not everybody knows what adequate, healthy nutrition looks like. But making sure that people can access those services, because what we eat is broken down to make our neurotransmitters to help us stay healthy and happy. A poor diet generally leads to poor physical and mental health. Sleep access and hygiene. Helping people learn what they need to do in order to get good quality sleep, but also helping them figure out how to get it. If they live in a 700 square foot apartment with 5 other people, it may be hard to get sleep. So what strategies can they use to improve their sleep, and how can they set their schedule so they can get better sleep? Once people recognize the impact that adequate sleep and circadian rhythm regulation have on their mood and their pain and their energy and everything else, a lot of times they're willing to make some adjustments. Stress management and coping and resilience education. And that can be through, again, PSAs, public service announcements. It can also be through handouts that are sent home from school, from the pediatrician. There are a lot of different ways to get information to people. Short little videos on your organization's website. Just get creative. Health fairs, or even like art fairs and community festivals. If you can get a booth there and hand out information, that can be helpful. Affordable, accessible mental health and addiction treatment. Well, obviously, if somebody already has mental health or addiction issues, we want to prevent those from getting worse, because by virtue of having those issues, it makes it harder for them to effectively connect, potentially, with the person that they're caregiving for. So prevention involves identifying caregiver factors causing them to be stressed and susceptible to dysregulation. So we want to look at the physical factors, the affective factors, the cognitive factors, environmental and relationship factors that all may get convoluted and contribute to their stress. And we want to ask them, and we need to survey them first, say, what factors are causing your stress? And then survey and say, okay, What do you think is the most effective way to deal with these in a meaningful way to you? Child and elder factors that might add distress to the caregiver are also important to identify. If it's a child with high needs, or if it's a patient that has dementia and gets agitated, or someone with schizophrenia who still has occasional psychotic episodes, that can add distress to the situation. So we want to make sure that the caregiver feels like they're equipped with the tools that they need, that they're competent to handle the situations, but they also have the ability to get support and respite, so everything is not always falling on their shoulders, because that can get exhausting. And finally, we want to explore ways to enhance engagement in these activities and in these things, asking people, obviously, if it's going to make their life easier, they're more likely to engage in them. But for example, the prevention programs. What can you do to get people to participate in them? Maybe if you offer them at a time when there's going to be a festival for kids going on in the next room at the library, so the kids have somewhere to go and the caregivers are also served coffee and light refreshments. Generally, food brings people. But thinking about, what can be motivating. Engagement is also enhanced in, right now at least, I don't know what the research was from the 80s, but right now, engagement is enhanced if information is provided in bite-sized chunks, handouts, bullet points, rack cards, things that people can read in 5 minutes or less and digest and get a tool out of. All of those things can be helpful. In terms of engaging other people in extended family, engaging them in serving as support can be super helpful. If they're going to be providing care, they also need to have the skills, tools, and resources in order to feel competent and confident in providing care for that individual. If they start to get frustrated, then the patient is likely to escalate. And as the patient escalates, then the caregiver escalates, and it's just this, they feed off of each other. So ensuring that there is an emergency plan, ensuring that people feel skilled and adept at handling those situations is really important. In terms of early intervention and reporting, I saw some of the comments. Yes, it can be really hard if you know the people, but it is still something a lot of us are required by law to do. So taking that step is important. And empowering the person as much as possible can also be important. In terms of dealing with the extended family, when there is a caregiver that is being neglectful or abusive, it's important to probably engage family therapy and help the family understand maybe some of the risk factors that were contributing to what was going on. Not to excuse it, but to help them understand things that they can do to help prevent it in the future. So some of those techniques, if you want to empower people for prevention, instead of worrying about eliminating the abuse, let's talk about adding prevention skills. It's a framing thing, but it can be helpful. Are there any questions? Alrighty, everybody, have a great day. And oh gosh, on Thursday, we are talking about the endocannabinoid system. So that is really cool. We're going to talk about our natural cannabinoids and how they're involved in pain, mood disorders, sleep, schizophrenia, and dementia. Have a great day.